the House Appropriations Subcommittee on Health and Human Resources. Thank you for coming. It's a Friday afternoon, so we're going to try to keep this. I'm going to try to restrain myself from asking the commissioner these questions that I like to ask him sometimes. Okay. Well, we welcome you. Come on to the microphone and introduce yourself. Commissioner Nelson Smith from Scott County. Scott County, that is a little known fact about him.
Mr. Chairman, members of the committee, thank you for having me here today. Commissioner of Department of Behavioral Health and Developmental Service, and proud to be part of the most amazing agency in state government.
Well, I know you've turned it all around. It's been transformative.
Thank you, sir.
Yeah, you're welcome.
Well, it has been a pleasure to work to get all this stuff shored up. But as you know, this is constant and it's constantly evolving too. We still have a lot to do. People in crisis are still being criminalized for their mental illness. In many cases, as you know, they're handcuffed to beds for many hours. And while they wait for treatment, we know that law enforcement, by code, they have to remain in custody with them. So they are also sitting there for upwards of 50+ hours, days while they're conducting their duties.
Mr. Commissioner, someone's going to roll this slide deck?
I have it right here.
Oh, okay, so we're still on the first page. Okay. There.
Yes, sir.
Okay, all right, okay. Thank you.
I'm doing my grand entrance.
You're, okay.
I'm going to build it.
So you're going to move the slides yourself?
Yes, sir.
Without assistance? Okay, thank you very much.
As you know, we opened up all of our beds. We've even added 56 beds with the closure of the beds prior to assuming the role here. And that still hasn't solved the problem. We know that wasn't the problem because, it goes back to years before. The state hospital is always full, trying to meet the mandates of the bed of last resort, but also with the justice system from the court accepting patients from jails. But we're also seeing a lot of fruits of our labor. And hopefully you've heard the judge overseeing the Department of Justice settlement agreement that we've been in for over a decade, 12 years. He agreed and entered an order for a permanent injunction, which is jointly agreed upon by the Department of Justice and the Commonwealth. It essentially ends the settlement agreement with the Department of Justice. So this has been a long time in the making. As you know, the governor well, first, thank you to the governor of the General Assembly. This has been lots and lots of investment over the years. Our DBHDA staff, the community services boards, advocates, providers, individuals, families, everyone has been fighting to be part of this whole thing, to make sure that Virginians with developmental disabilities can live the best life that in their communities in the least restrictive settings. Essentially, we built a system that didn't exist. So at any rate, today I'm going to share some of the governor's proposals. In FY25, we're adding $53.5 million. In FY26, $56.4 million, and we'll talk about some of that here. First of all, we're in year 3.
Mr. Commissioner,
Mr. Chairman,
are you going to tell us what you agreed to with the Justice Department at some point? I mean, what have you committed us to do in the future?
Mr. Chairman.
Yeah.
Yes, sir. We have sent copies of the permanent injunction over, but we can make sure you get those.
Okay, thanks. Look forward to reading it.
And happy to, we could probably do it at a separate time. Happy to bring you up to speed on that.
Okay, yeah, it's Friday afternoon and it's pretty complicated.
Absolutely.
Thank you.
As you know, we're in year 3 of the governor's Right Help Right Now plan with historic investments. As a matter of fact, it totals about $1.4 billion. I think the secretary highlighted that the other day. But the really cool part of this whole thing is that we're building the best-in-class crisis service, which is the keystone of this whole thing, and we're actually one of the leaders in the nation with this. And then we are continuing to work hard to eliminate the Priority 1 wait list with all the waivers that we've been able to get assigned. A large portion of this budget for us is, to me, I think it's a game-changing proposal, and it has multi-levels of impacts. As I mentioned, all the people waiting for beds, law enforcement sitting, we introduced what we call these Special Conservatives of Peace, or SCOPs. They're specially trained in crisis intervention and also trauma-informed care, which equips them to support the individuals while they're waiting, more of an empathic approach. They also use techniques that can help reduce the use of physical restraints. Again, the use of handcuffs when people are in crisis while they're waiting on beds during the custody period. Unlike law enforcement, whose presence alone can unintentionally increase some of these individuals' anxiety, as you can imagine, body armor, guns, sitting there with them, that might just alone escalate in many cases. This will hopefully, these SCOPs will not wear those uniforms, again, trained especially to be what we think is being part of the care team while they're there, providing a first interaction into our mental health care system. Again, we think it'll have a great impact. It'll also, we hope, aim to reduce criminalization of mental illness. We started a pilot last year in Southwest Virginia using steadfast security to provide these Special Conservatives of the Peace to maintain custody and transport. And you can see some of the benefits of the pilots on this slide. In addition to alleviating the burden, some of the other outcomes that we've experienced is reduced drop-offs dramatically. You know, these are patients that haven't been cleared, and they just bring them and drop them off at our state hospitals, which is dangerous for all parties. Also informed with these lessons, we rewrote the alternative transportation contract, and we expect to award that contract later this month. We also use carry forward funds to demonstrate a demonstration for SCOPs at 3 private hospitals we're hoping to do soon: Valley Health in Winchester, Chesapeake, and VCU. DBHDS will provide funding for each of these sites for up to 10 SCOPs trained in trauma-informed care in order to meet these needs 24/7 and for hospitals to better manage this crisis that we've been facing for a long, long time. Also in the funding, the governor's budget has the $35.2 million will allow Virginia to expand this to regions 1, 2, 4, and 5. So we hope that it'll have an impact on all of your constituencies throughout the Commonwealth. And law enforcement will be very happy, but also, again, the patient experience, that clinical care team. Also, we're adding $1.5 million for DBHDS to contract with the Medical Society of Virginia to maintain the Adult Psychiatric Access Line, or APAL. It's a consult care navigation program to prepare primary care and emergency clinicians to support the needs of adult patients who are struggling with substance use disorders. The funding will be enough to sustain the 2 regional pilots. We hope to expand this in the future. It will also add a consultation for mental illness. So we started with adults, and this is built on the frameworks for VMAP, Virginia Mental Health Access Program, which has been wildly successful. Pediatricians gives them the supports and things that they need. This is just providing supports for the primary care physicians in the Commonwealth who are dealing with it right now, and they don't know what to do. So now they get training and supports. It's just a really, really tremendous asset.
There's a bill working its way through. I think it'll find a welcome reception. We had 2 delegates who'd like to ask a couple questions while we're on this subject. Delegate Krizak.
Thank you, Mr. Chairman. The SCOPs, the $35 million, you've mentioned everything but a rationale, financial rationale, which of course we are the Appropriations Committee, and then all the other stuff is nice and important, don't get me wrong, but I really want to know about the financial, the economic rationale for that. Why is this cheaper than using police or sheriffs, deputy sheriffs? So if you don't have the answer now, if you could just provide us, the economic argument for this. Thank you.
Mr. Chairman, thank you, Delegate. I'll get you that. I think one of the direct cost is going to be the overtime in those localities that I've had chiefs sending me their overtime, showing me what they're spending. And if you add that up, I think, again, I was speaking to that, but I don't have that on hand.
Mr. Chairman, to follow up?
Yeah,
that's exactly what I want to see. Thank you.
Okay.
Thank you. And He's the chairman of our Public Safety Committee.
Great.
Here too. Okay, Adela Coiner.
Thank you, Mr. Chairman. A couple of questions. The first, following up on Delegate Creasy's question. It's always hard when we're spending money in area because we expect it, well, one, to provide better service, but two, you expect it to have a positive impact in a budget somewhere else. Sort of in line with that, not just what we anticipate, but building into this budget item to track the data associated with decreases, asking for that data to be collected on where they're no longer spending that. So I think it just makes the case now and in the future when we decide to spend more in an area because we believe it will have a positive impact in many areas, including the budget. I think it's a little bit easier to look at. So that's a question about whether or not that's possible to do. And I have two additional questions, Mr. Chairman, if that's okay.
Please proceed.
Thank you, Mr. Chairman. Trying to better understand what the background needs to be in a special conservator of the peace. The acronym SCOP still makes it sound like it's in the police area, but so just I didn't really quite understand what the background would be in someone serving in this role.
SCOPs have been around for a while. When I learned about this, that they're allowed to take custody. We actually had them in our facility years ago. I actually have a little badge someone gave me. But they go through the Department of Criminal Justice system, and they're sanctioned by the courts. And then what we're doing is adding the CIT program and trauma-informed care to it to make sure that they're going to be hired specifically, knowing that they're being hired to sit and basically engage with this patient while they're waiting.
Follow up to that, Mr. Chairman.
Doga Corner.
I guess I'm still unclear. Do you have to have a degree that's in law enforcement or criminal justice, or could you be a social, somebody who's worked in the social services area? That's what I'm more asking.
Yeah.
If we have folks who've been more in line with that area or mental health, could you go through training and qualify?
Mr. Chairman, Delacorte, I don't know the specific qualifications for the basis for that, but I'll find out.
Okay. And my one final question, Mr. Chairman.
Certainly.
My last question, I see here where they will be used to maintain custody during that period. But, one of the things I've consistently had as a big issue in my area where we're located, when law enforcement takes someone to a hospital to be evaluated as to whether or not they should remain in custody or to go permanently to a bed, if they're determined not in need, not emergency, when the hospital stops that service, they're just let out on the street. And most of them don't have a cell phone with them. Like in my area, folks have been taken as far as way out in Henrico to be evaluated, which is a 45-minute, how to figure out how to get home in 45 minutes. And you don't have transportation, you don't have family, you don't have a cell phone. So whether or not we're anticipating a role for folks upon release, is there someone that the hospital can contact to help these individuals wherever they came from get back home? Because it seems to be a gap right now.
I think has a question. And what is the discharge plan?
Mr. Chairman, Delacorte, that isn't part of this thing. That would be on the facilities themselves and what their protocols are. I couldn't speak to that.
So, it is. We've had complaints about this before from some of our delegates that people are just being let out on the street from private hospitals with there's no discharge plan. Right. I think at our hospitals, I'm sorry if I'm messing up your line of questioning, but what do we do at our psychiatric hospitals when someone's getting ready to leave? What kind of planning is done?
For our hospitals, Mr. Chairman, the state hospital, I can tell you that we have a discharge plan, which includes getting them to where their destination is.
Okay, so these new SCOPs are just going to be in the emergency rooms, but they're not really part of. You're looking for something more than that to help folks. Am I right?
Yes, Mr. Chairman. It's really been the case where individuals have been taken for evaluation as to whether or not they should be kept when they don't want to be. Right. So they were perhaps in our local jail, and then they end up being released, and then they're immediately taken for emergency evaluation, and they're deemed to not need to be held. And so they never really were admitted, right, as a patient. They were being evaluated as to whether or not to be kept when they didn't want to be against their will. So then we just leave, it's deemed that they don't need emergency, and yet they're still there, and there's nowhere
Would
to
it be
go.
okay with you if you could talk to the commissioner after
Yes.
this and figure out exactly how this money's gonna be used and who's gonna be qualified to be an SCOP
great.
and that type of thing?
Mr. Chairman, if I may, to the delegate's question, I think that is a separate problem. We're trying to solve. This one specifically is for that patient that is under that custody. Now, I absolutely understand what you're explaining, and that makes sense. The law enforcement drag them to a place, they don't meet criteria, and then whose responsibility is it to get them back, which is a separate issue. I think that would be within that hospital and what their protocols are and/or what now we can talk about. I think that's something we can solve for. I need to understand how many, what's the volume we're talking about. You know, is it a statewide or is it just in one area? And I haven't heard enough about that from my position. So, but yeah, I think absolutely we can talk to solve
Okay.
that one.
And another point here, and Delacorte, see if you agree with me on this. We are trying to set up a crisis response network that we don't have now. We have a certain number of chairs out there. We have a crisis response center that if we have this in place, people who are having a psychotic experience will not be in the emergency room.
Yes, sir.
They'll be at either one of our CRCs or a crisis stabilization unit, which is a bed they can stay in for a few days. So to the extent we build our community supports that we're trying to do, and it's hard to do, it's pretty slow, the less we'll need SCOPs.
That's right. Mr. Chairman, precisely. So this is this is an immediate alleviation. It's going to reduce the negative interactions that we hear often with law enforcement in the emergency rooms. Again, the presence, escalation, it's therapeutic because it's part of that first experience for someone experiencing a crisis. Now you're being handcuffed. You have to sit there. We're trying to get law enforcement out of that so they can, number one, be in their community, but the other thing is therapeutic. The other part of this is you've seen forensic. My forensic population has risen drastically since the bed closures. So now we've seen what may happen is if a law enforcement comes to a certain place, you can either make an ECO or an arrest. And so now I have a third of my state hospitals have people that are there for competency restorations. It could be an individual because of their illness, trespassing, or whatever it is, and then they get arrested and they get into the judicial system. We expect that will go down as well. So decriminalization, when I say decriminalization, law enforcement has a choice. They can go up and they know that they're going to be able to transport and transfer custody to a hospital and go back to what they were signed up to do.
Dan, I mean, this is a big priority of the sheriffs and the police departments.
Well, again, what I'm trying to present is this therapeutic too, and we're going to be able to prove that, yeah.
All right, if it's okay with the subcommittee, we're going to continue here.
And the business case, absolutely agree. Hours, overtime, all those things, and the reduction in forensic census when the state is being charged $1,500 per day, and we can reduce that. So absolutely agree.
Okay. Next slide. We'll try to not interrupt you so much.
All right. On this slide, we start with the $1.4 million in non-general fund dollars for problem gambling treatment, which is going to support the fund that was created in 2020 from the lottery, casinos, and sports betting. As you know, that's increasing, so are the funds from that. It's going to go towards supporting statewide education, prevention, and services around problem gambling and treatment. Next, we have $1.2 million for crisis co-responder programs. I hope you're all very well aware of that. It pairs specially trained law enforcement officers with a licensed behavioral health clinician to respond to people who are in a behavioral health care crisis. Again, we're reducing those negative interactions. With these programs, we see increased safety for both the officers and the individual in crisis. Again, fewer arrests, putting things away from the criminal justice system and into treatment. And then finally, on this slide, is a proposal for DBHDS to fill requirement for a measurement tool for evaluations of the Virginia Assertive Community Treatment Teams.
Delegate Krizak.
Commissioner, thank you, Mr. Chairman. Commissioner, regarding the, going back to that slide, the problem gambling treatment sport, where is that coming from?
Mr. Chairman, Delegate, the funding,
Yeah.
it comes from it was when we created or allowed these casinos or gambling to come in, they give a certain percentage of that goes to the problem gambling fund.
And most of it's coming from sports betting.
I'm sorry, for sports betting, right.
Right, at
Okay,
this
Mr. Chairman.
point, right?
Yeah, Mr.
And the casinos that are being built all over.
So
Right,
that's
what
all
I-
non-general funding.
But
That's
this is
what you have.
not, Mr. Chairman?
Yes,
This
sir.
is not new, this is not new money, this is what's already allocated from.
That's right.
Okay.
We have to
'Cause
ask
I
for the
have-
appropriation.
I have some budget amendments that are going to increase this. Okay, thank you.
Thank you, Delegate Creasy. Please continue.
Let's see.
In other words, that money was already going to be here without the governor's
In
suggestion.
2023, the judge overseeing the Department of Justice settlement agreement scheduled a contempt hearing due to the Commonwealth failing to meet the requirements. To avoid these proceedings, the Commonwealth agreed to add staff and contracts needed to increase compliance. This budget amendment answers that call for nurses, behavioralists, quality improvement specialists, dental assistants, and funding for sedation dentistry contracts. Next, the administrative requirements naturally increase as the number grows of Virginians who have received DD waiver providing access to the critical community services. This amendment would allow us to increase our service authorization team that is tasked with approving, pending, denying, or rejecting service authorization requests within 10 business days required by the regulations. There were 126,310 of these submissions in 2023, which means each of the current team members reviewed and acted on an average of 6,014 requests per year, 501 per month. Basically, as we increased the waivers, we have to have the people to be able to.
But, you know, I'm glad you funded yourself, but you're sending these things to our CSBs, and there's no money in your budget for them to handle it, the actual people that are the sport coordinators. I think we're going to have to put some money in the budget to do that, which you did not do. I mean, this is just taking care of your own agency, who is not in charge of the ultimate implementation of these 3,440 waivers. So anyway, I hope the governor will sign the bill when we try to fund those.
Administratively, we have requirements that we have to meet to
Yeah,
get these things assigned.
But the way this
processed.
program works is the CSBs have to implement this. So you're just sending them the money, and you're making sure that your staff is big enough to send the money to the CSBs.
Well, I would, Mr. Chairman, agree, but I would argue that this staffing increase is going to help them also. So they have to process this.
Heather, can you tell us, or
No,
can you
no,
tell us how that is going to help them? Because I need to get educated on this.
Thank you, Mr. Chairman. So what these staff are for, actually the authorization of the services that the individuals will receive. And so when the support coordinators submit the plan, our agency has to review those plans, has to authorize those services so that individuals and providers can actually get paid to deliver those services. So when Commissioner Smith was talking about the 123,000 authorizations, that's the actual services that individuals get connected to and our team has to process those too so that they can actually get services, not just have access to services.
Yeah, well, that's good. So when you're finished with your job, there's a really long lag between when the family starts getting the services, because somebody somewhere in Virginia that works for a CSB has to work with that family to make sure these services are provided. Am I right about that?
You are correct. So the process is the waiver slot gets assigned to a person. The family has a certain number of days to accept the slot that has been assigned to them. Then within another certain set of days, the support coordinator needs to meet with them to develop a plan. Then they spend probably the next month identifying a provider to deliver those services.
That's all your staff?
No, the support coordinator is the one who is meeting with the family to determine what their needs are, and then also helping them to identify providers. We do support the case managers and support coordinators in helping to identify providers in the localities for the services that they're seeking.
So you don't think it's crazy that the CSBs might want more money to help them do this
No,
historic workload?
I have actually seen the VACSB's proposal about additional funding related to support coordinators, particularly around the onboarding of them and training them up before they can manage an entire caseload and then start billing for the services. There is the ability, obviously, for the case management service to be billed once the case manager has been trained up. And we have been working with several of the CSBs to identify ways that the department can support the speeding up of the onboarding of those case managers and helping to take on some of those responsibilities related to training in all of the different processes related to the DD waiver.
Okay, thank you.
You're
Sorry,
welcome.
Mr. Commissioner.
Mr. Chairman, thank you. Was just commenting that not all the CSBs are in the same situation. Some are very well staffed, some aren't, so
We know that.
it's not very linear.
That is something we know well.
Our dashboard demonstrates that, by the way.
Thank you.
All right.
Part C.
Next, the governor's amendment focuses on Part C services that provide early intervention for toddlers with disabilities or developmental delays. Basically, this covers the 5% increase that we experienced from 22 to 23 and absolutely meet the growing need that we have. Next is the proposal to build a sustainable entry-level youth mental health workforce by creating a pipeline of trained, certified, and employed youth peer support specialists. This program will target young adults from 18 to 25 who have lived experience with youth-serving systems such as the behavioral health system, foster care, juvenile justice, or substance abuse disorders, empowering them to assist others facing similar challenges. Almost like a train-the-trainer model. As you know, peer support is a tremendous thing, and people want to help. And so we want to create pathways to do that. Finally, on this slide is funding for a Youth Mental Health Matters initiative to improve mental health care literacy. We all know how difficult it is to understand the mental health care system, especially at young ages. 12 to 18 will be addressed, and we'll talk about the impact of drugs and alcohol on mental health, raise awareness on the effects of social media and excessive screen time. This program is already in 11 states. The funding would be used for program development, outreach, and partnerships, and the creation of engaging educational content for schools, community centers, and online platforms. We expect that this would reach 2 million youth across Virginia.
So you're going to develop programs that other the social services departments can use, or you got for $1 million you can't do that much.
Mr. Chairman, yes. This is a specific program, Youth Mental Health Matters, and what we're saying is this funding will help us do that here in Virginia, and it's providing good results for healthcare literacy for youth.
Okay.
So we're just going to do the program here.
Okay. We can talk more about that. Thank you.
As I mentioned before, you all are well aware, our hospitals, state hospitals are extremely high censuses. We've reopened, again, all the beds, added 56 more beds, as I committed to when I first took over, and that hasn't alleviated the pressures. As soon as we open them, they're filled with forensic patients. Since 2014, forensic patients have increased in state hospitals by 93%. The primary driver is restoration for competency to stand trial. Court orders for this has increased over 140% in the past decade. There are other concerns that we're dealing with, which is increased pharmacy costs at our facilities, and they have risen 164% over the past decade. Between 2022 and 24 alone, inflation has resulted in a 15% increase in costs in psychotropic medications. And also with the increase in the forensic patients, pharmacy costs have risen because they use a lot of these long-acting injectable medications, which really does impact their stability, especially once they discharge. The governor's budget introduces funding to reduce these costs or meet them. We are struggling, or we struggled with staffing, as you know. We've made tremendous impact reducing that to just teens. When I took over, it was 36% vacancy. Now we're down into the teens, getting more in line with normal industry standards. But we still struggle in some of these other areas. We've been, with the help of the General Assembly, targeting some of these, the nurses, frontline staff, social workers. Last session, we got to the food service, bringing up to a nice living wage. Now we would like to address the trades, the people that are behind the scenes, keeping the wheels on the machine, the electricians, the plumbers, and all those folks. The infrastructure and physical plant is incredibly old and outdated, and they do some really genius maneuvering to keep it running. So we would like to address that. Next, the budget proposal funds 4 additional evaluators for 3 hospitals with the highest forensic populations, Central, Eastern, and Western. These positions will speed up the evaluation process, thereby, throughput, so we can get more people off the wait list and back into their communities. And it'll lower our length of stay, which is essential given our current hospital census. During this administration, DBHDS has reduced the amount of time that it takes to get a license in Virginia. When I took over, it was 18 months to 2 years. We've got that down to 30 days. What that means is increase access to care. We have providers, plenty of providers now. What that means also, conversely, is we still have a mandate to make Virginians are safe, that these places are operating within what they're supposed to do, and we cannot keep up with the volume. So what we're asking for, as a result of the past 2 years, the number of providers has increased in Virginia by 56%. Again, that's wonderful, right? Licensed services have increased by 38%. But we need to rework our process to make sure that we're keeping Virginians safe.
How many FTEs, Mr. Commissioner, how many FTEs are in that licensing, the funds of licensing positions? It's 663 of the 663,000. Is that that's all personnel?
5 additional positions.
Okay. Thanks.
We've also done an internal deep dive into the licensing division itself to make sure that we're operating efficiently. And so some of those things are going to help as well.
Oh, good.
Yeah. Here, we recently had a contractor, and we did an assessment of the licensing office to rework the workloads. And we'll implement a lot of those recommended processes, but we feel like this will help us because the ask was, licensing folks will tell us I need more, but we think some of the processes plus this will get us closer. Next, we recently completed a cybersecurity exercise with Oracle Health, which emphasized the significant cyber risk DBHDS incurs as a healthcare system. You've heard throughout the nation, targeting, okay. Also, this just adds another IT position to keep our EHR safe.
I meant I think the slides are one behind. No,
No.
now we're good. Okay,
Oh, no, it was good.
okay.
Sorry, I thought you were telling me to speed up.
No, well, you can do that too.
It's like, okay.
No, we know you've done a great job.
But yes, we need to keep our, DBHDS is becoming a really technologically advanced agency. We're moving a lot of our things to the cloud. Really proud of our CIO, who's done a tremendous job. We're upskilling all of our IT folks to AWS certification so we can maintain things in perpetuity. Again, we're more than just a behavioral health care company. And I'm very proud of them, but we do need IT security to make sure those back-end systems are safe. These are several language-only amendments to take note of. First is an amendment to make the budget more consistent with regulations for making grants for recovery services. This is important flexibility as practices around recovery residences evolve. Next, the language passed last year around school-based mental health inadvertently had a negative impact on the significant progress done by the pilot, and this just puts it back to the way it was, so we can work with the school divisions again. And then finally, the language around SCOPS will allow DBHDS to set up contracts with private hospitals and other qualified agency for the new demonstration sites. Mr. Chairman, that concludes my comments.
Thank you. Thanks for coming here. Do many members of the subcommittee have Delegate Hodges?
Thank you, Mr. Chairman. Thank you for being with us. It's always a pleasure, and thank you for what you do each and every day, and all of the folks that work with you. With the SCOPS, will that be jurisdictional, or would they be statewide as far as, if you need someone in Richmond or need someone in my area, can it be that same person, or will they only be available in that one jurisdiction?
Mr. Chairman, Delegate Hodges, great question, because they are certified by those circuit courts. I think it's going to be locally, so then it'll be up to those facilities. In that, we're working proof of concept that we've already got in place. But what they have to do now is they get certified by that court so they can operate within that locality. But then the more complicated part of this now is, which is why we'd like some language, but each law enforcement locality has to get an MOU with that hospital, because each locality, because they're transferring custody. But we have a team that's in place, and we're helping kind of handhold and get that done, because again, we're very excited about this.
And you've tried this in Southwest Virginia. You've got a pilot.
Mr. Chairman, yes,
right?
sir.
Okay.
Yep, tremendous results.
Did you have a report on that? Did you give that, how it's been, someone evaluate that program and
Yes, Mr. Chairman, we do have the numbers, as I mentioned.
Just send it to us later.
Yes, sir.
Yeah.
A big part of this too is that what we found in Southwest Virginia is that the patients that are in the custody of our SCOPS, 78% of them are actually finding their way into private beds.
Yeah.
Which again is another calculation we can put in.
No, that would be super positive, actually.
Right.
The more you could do that. Okay. Any more questions down here? The staff have any question? Ms. Cochran, Ms. Massart? Okay.
Thank you, Mr. Chairman.
Thank you for coming today.
Have a good weekend.
And I think we'll be talking to each other the next couple of weeks about how all this work out, because we don't have all the money we need, to do all this stuff.
Thank you, Mr. Chairman.
All right. Do we have anything else on the agenda?
Yeah, we have the Commissioner, DSS, James Williams.
Oh, Mr. Williams, please, welcome. Welcome, introduce yourself and.
Glad to be here.
Yeah.
I know, I can tell you're very passionate about social services because you're taking me up at 3:30 on a Friday.
Well, it's the entryway. You're the most important place.
Well, appreciate that.
Make
Appreciate
sure
the
people are
opportunity.
getting the services they need.
Chairman, great to be here. My name is James Williams, Commissioner of Social Services. You probably remember me from my role as Deputy Secretary of Health and Human Resources. Right. And at the time, I was mostly working with Commissioner Smith on launching Right Help Right Now. So that opportunity actually gave me a lot of insights into how a lot of our agencies work together. It was a great experience, and now I'm in this seat as of July. And it's been a tremendous transition, largely because I have a great executive team that's here with me today that you know well. Let's take the next 15 minutes and talk about some of the priorities at social services. Is the slide deck coming up here?
Yeah.
Okay,
Yeah.
there we go. Is it intuitively the right arrow, or how does one move
The
forward?
opening page, I think.
Yeah.
Can you want to go to the
This guy?
try?
There we go.
There you go.
All right, it's the mouse. All right. Okay, well, very quickly, I'll just give a financial overview of the agency. We'll talk about priority areas of investment, and then we'll finish out all of the governor's budget amendments. So as you know, our total spending for state fiscal year 24 was $2.9 billion. Almost half of that is federal funding, and about 20% is general funds. The local funds there are not actually appropriated through our state budget, but just wanted to represent that there. Of the fiscal general funds from the state, about a third of that is actually going to local department operations. And that's just an important point that I want to make. This is the front door to all of our benefits delivery and all the services that we offer, obviously. And an important point is that those local services really only represent about 4% of our overall economic impact when you think about the scale of social services. When you add up all of the benefits that are administered and all of the eligibility work that's done by those teams on the ground, it's basically a 4% overhead, which is pretty good. The point here that I'll continue to make throughout this presentation is that while our benefits have increased significantly over the last several years, the staff that actually administer those and administer the eligibility has been essentially flat since pre-pandemic. As you know, DSS serves children by ensuring safety and welfare. And here are the numbers of children that we serve throughout some of our programs. I just want to highlight one really significant success story over the last year. And thanks to the General Assembly passing and the governor signing the historic kinship legislation last year. What you see here in the bottom right is the number of children that have actually been served through that preventive kinship program, the Parental Child Safety Placement Program. That was law as of July 1st. And the State Board of Social Services finalized regulations for that program as of late last year. And those are effective as of this week. So that program is completely cemented, and we've infused safeguards to keep children safe through that program, but also make sure that they can stay with kin and with the aspiration of family reunification. So far, that has been a phenomenal success. Moving away from the preventive side, I want to talk about kinship foster care. So what you see here, over the last few years during the administration, we've had a concerted effort to train local departments on prioritizing kin first, having foster children placed with relatives and fictive kin. And so we've gone from bottom in the nation to 20% as of late last year, and our aspiration is to exceed 35%, which is the national average. So turning over to budget proposals specifically related to children, first I want to talk about what we need to do to enhance child protective services. And as you've been watching the news over the last couple of years, you've seen cases like the Henrico doctors case unfolding, and you've seen the news of the Newport News teacher shooting. The point that I'd like to emphasize here is that our child protective services system is overwhelmed. The workloads are far too high. Over the last year, we've seen over 100,000 child abuse and neglect complaints that have been received by the system, which is unprecedented from the data that we've looked back on over the last several years. So looking back on even the Office of Inspector General's report from 2022 that reported and highlighted high caseloads at the time before we had unprecedented numbers, lack of staff on the state hotline, and inadequate staffing levels at the local level. So this budget proposal is $7.9 million to an initial first step to invest in the child welfare system. The first phase of this is $500,000 to overhaul the technology for the actual CPS hotline, which I receive many complaints about on a weekly basis. And the goal here is that, with a typical system that you would interact with when you call your bank, we could actually reduce the amount of work for our workers and make sure that people and complaints are getting to the right place to begin with, so that staff don't have to make all of the referrals. So with reducing some of the actual work on the front end in this year, The initial investment in personnel would begin in state fiscal year 26, and that represents 60 local staff, CPS staff, 12 local supervisors, and 5 regional consultants at the state level who provide technical assistance to our local CPS workers. Second, I just want to highlight foster care and adoption cost of living adjustments. This is a 3% increase in the Appropriations Act, and this is essential so that we can continue to recruit families so that they can continue to serve as foster families. The last item here is cost of administrative costs, primarily inflation adjustment for administrative costs, mail, legal services, et cetera. And next, I want to transition into how DSS serves families. So this is an overview of really the number of enrollees in our primary benefit programs over the last couple of years since March of 2023 when the unwinding from the public health emergency began. So what you see here is a roughly 8% decrease in Medicaid enrollment. At 2 million enrollees in the Medicaid program, I just want to emphasize that we are still, that's several 100,000 enrollees higher than we were at in early 2019. And that's about a 50% increase in workload, eligibility workload for the local departments. So when we see backlogs throughout the system, part of the reason is that those benefit workers are also overwhelmed. Some of the top reasons for the decrease in enrollment on the Medicaid side, eligibility for families moving away, individuals passing away, exceeding age caps and income thresholds, and requesting benefit cancellations, actually. Want to highlight here as well, the Virginia Sunbucks program was launched over the summer for the first time and served over 700,000 families and kids. And that was largely a success. Our federal partners gave the team great praise because that was such a successful launch. And I just want to emphasize that that was a very quick turnaround. We went from a proposal last December, 2 Decembers ago, to you all appropriating the funds for that, and we launched that within months. It was just a tremendous success by the department. Here, I just want to highlight that our TANF caseload has gone down significantly. That is also associated with the unwinding from the pandemic. A lot of the flexibilities that were instituted during the pandemic ended as of January of 2023, and we started to see the numbers and the impact of that take place largely this year. So that's why you see a decrease in the overall spending in the TANF program. Our VIEW program had similar impacts, but we are trying to bring that back to life. Our LIHEAP program increased due to a $101 million federal appropriation in federal fiscal year 23. So we'll continue to see that flow through our system. You've already heard about the child care subsidy program, so I won't bore you with the details on that again, but I just want to emphasize that we do think that in order to serve families well and reach more families through the child care subsidy program, that instituting maximizing co-payments, the job search, and attendance is critical from a DSS perspective. I want to switch to just very briefly talk about what we're doing at the department to try to bring life back to our self-sufficiency programs. We're creating partnerships with large employers throughout the Commonwealth, and we're trying to create some understanding from an employer perspective what it looks like to work with DSS. And sometimes that can be difficult, but actually the agency has a lot to offer with our sister agency, Virginia Works. So we have tax credits that large employers can take advantage of, and we're really stacking up all the benefits that employers can reap when they work with DSS. One of those benefits, in addition to the tax credits, is our full employment program. And this is a program that actually gives employers subsidies of up to $1,000 a month for up to 6 months if they hire one of our TANF clients. And that is to offset training costs if the employer wants to train that individual. And so we worked with a very large healthcare company that's present throughout Virginia, And we've now trained 20 localities on this economic model of what it looks like. And this is the figure here on the right. This healthcare company is taking on our clients and starting to enroll them in nursing programs. And so they have a part-time job while they're in nursing school. And by the end of the 4 years, our aspiration here is that they'd actually have increased savings. They would be less reliant on our benefit programs, and they'd have higher wages because they would have completed a nursing program. And so this has just been something that we launched in the fall, and really excited to see the results of this work. But in order to be more successful with employers, we need an expansion of our full employment program. And that's one of the proposals here. What it would do is it would actually allow for volunteer work to count towards full employment program. So if a nonprofit wanted to take someone on, train them in a new capability, and then that nonprofit could actually receive the same subsidy that a large employer would. And what we're seeing is a lot of nonprofits actually are the first entity that actually wants to hire our client. And then that's kind of that's a first step into that person getting into a career pathway. The same would be for a higher educational institution. So in a partnership with a nursing school, this large healthcare employer, for example, could actually establish a partnership with a higher ed institution to share the subsidy with a nursing school.
Out of curiosity, what nursing schools are you working with?
None yet, because we don't have this approved.
Okay.
So today the subsidy works and it passes through entirely to the employer. So they're the only ones who would benefit. What we're trying to do is we're trying to get higher ed institutions and nonprofits more engaged in this, so that we can get people on the road to self-sufficiency.
Well, I can tell you there's a whole lot of nursing schools that are trying to up their game, including 15 private ones, and then a lot of our schools, Bradford, JMU.
And the General Assembly did appropriate funds for the Nursing Accelerator Program to basically have paid for clinical hours as well. So we're hoping to actually partner with that program as well to really make it sustainable for someone who has nothing in their bank account to get through nursing school, and create a model by which they can do that. And we're looking for more career pathways. So we're open to recommendations if you have any.
I think you need to talk to Delegate Rodney
Okay.
Willett. He's our expert.
I'll take that recommendation. The next item I want to talk about here is modernizing our 211 system. So as you know, last year you appropriated funds to revamp our Common Help application, which is the front-end portal for our benefits system. And so we are underway with that procurement. But a part of this system is actually making sure that we have a good referral network. And 211 is a great way to do that because it gives people an opportunity to just pick up the phone and call, and it helps them navigate the complex web of government programs. And so this will actually connect not just to our aspiration to Common Help, but also to the Opioid Impact Reduction Registry at VDH and other resources on the OAA. Next up is a series of proposals to ensure that our programs are run well and that we have investments in program integrity. The first item here is enhancing our electronic identity verification. So this is a service that the Virginia Employment Commission actually deploys with great success. Almost 80% of the individuals applying for unemployment benefits through VEC now use a single sign-on service like this. And it makes the process faster, more efficient, and they're able to verify the person's identity. So it reduces theft, fraud, which we're seeing in some of our benefit programs. So we think that integrating this into our application system, since we're the front-end portal for most of our applications, including some of the ones that end up in the Virginia marketplace, would really add to the program integrity of our system overall. The next item is increased procurement staff. For procurement staff. This is really crucial because we are undertaking an unprecedented number of procurements at DSS. Our procurement officers have about 80 contracts that they oversee on a regular basis. The industry standard is no more than 50. And our contracts are pretty high risk, as you know. We're dealing with CMS, we're dealing with FNS, and they don't like things being late. And so we need a handful of procurement officers so that we can deal with high-risk contracts is the long and short of it. And the last item here is funding increases in employment and income verification. This is a crucial service. What we're seeing is that this is a national issue where the rates for these services are going up significantly, and the department is continuing to push back on that. But we could not have this service today. If we're talking about backlogs in Medicaid already, we would see backlogs rise with no income verification services. So this is an absolutely crucial service that the department uses and relies on. But we will dedicate ourselves to looking at alternatives over the next 12 months, and we have already been doing that. And so we hope to come back with different answers in the next budget. Here, this slide looks a little gruesome because it's all negatives, but these are adjustments in funding for cost of providing foster care and adoption subsidy payments. Largely, this is bookkeeping to ensure that we're in line with recent expenditures, and also continued impact of our child welfare policies. Technical amendments here, very briefly. The first one here, these are just to streamline efficiency. This is our Sunbucks program. We're continuing to invest in our LIHEAP appropriation that I spoke about earlier, and a non-general fund appropriation to accommodate local social services raises, and also a federal pass-through to local departments. And lastly, we're rebasing our agency appropriations to provide funding in a few correct program areas, clarification for our PIP contract to clarify who does what in the PIP program between the SEC and DSS. And then lastly, we're transferring several MEL over to the Department of Education, since obviously the child care subsidy program moved over there some time ago. This is just a bookkeeping exercise. Any questions?
Delegate Krizak.
Thank you, Mr. Chairman. Commissioner, the Virginia has, and you had a slide mentioning adoptions. I'm an adoptive parent, and it's a very wonderful thing when you can adopt a child, especially these children who have no parents. And we have 1,100. Is that correct? 1,100 kids on the list. From what I understand, Mr. Chairman, we are one of the laggards as far as the states that has adoptions. And it's not very easy I know my constituents complain. We've got constituents who've had their home studies waiting years, and it's very difficult. I think Virginia is the only state that doesn't have any listing online or any way to get profiles of the children that are waiting to be adopted. Is there like a hotline or any kind of number that somebody can really help constituents with that are trying to, because they really have had a difficult time navigating the system?
It certainly is complicated. In terms of a hotline, I'll turn that question over to Deputy Commissioner Carl Ayers to talk a little bit about what's going on in our referrals for adoption services. But a lot of those referrals happen at the local level.
Welcome. Introduce yourself, please, Carl.
Yes. Good afternoon, Mr. Chair, Delegate Krizak, Carl Ayers, Deputy Commissioner of Human Services. Great to be back with you this year on another session. To your question around the adoptive families, is we previously used to have an adoption listing online that was called Ariva. And for any of you that work in this, and it used to list not only the child's information that were available, but their photo listing that came along with that. As human trafficking has increased, then we've moved away from those online listings of children that are available for adoption as a protective factor for those specific children. So you don't see those anymore. And if you go way back, we used to do these with photo books and things along those lines before the internet. And so for that specific piece, we have a listing from that end of it. We have specific information, but we no longer have that photo listing from that end of it. And it was strictly poured down on administration's decision around safety of children, specifically related to human trafficking, as we do not want to place our children in foster care who are already the highest risk of trafficking to be put at any further risk from the end of it. So it's a little bit of give and take in how do we protect the children, but also trying to find permanent families for them.
Doug Krizek, you have a follow-up?
Yeah, thank you, but you're going to have to come to my office, okay? And we can deal with this one constituent in particular. But he is very, I mean, they have had a real runaround from your department, and they've talked to multiple agencies. I know it goes through the local. They work with the Fairfax County government. It's got to be a better way because, and I know the rest of the country has not taken those pictures down. There must be a way you can encrypt them or do it so that just those you have it available for parents who've already gone through the home study and something like that. There's got to be a technological fix that can be a little bit easier to work with. But these are folks who are, who are real. This is a very emotional kind of a issue, right? So I think we need to do a better job on this. I mean, we're probably with one of the least, where we had the least amount of adoptions. Now, if we don't have any kids that need to be adopted, that's one thing. But if we do have, and I heard 1,100 as a figure, then we need to do everything we can to find parents for these children. I think it's really important. Thank you. Come to my office.
Mr. Chair,
Yes,
Delegate
sure.
Krizek, I will follow up with you, and we'll have a much deeper conversation around this and what we can do.
Okay, just generally, either one of you, what are we doing to try to encourage people to adopt children and be foster parents? Because even in our foster care program, we're very low compared to for a state our size.
Yes, sir, Mr. Chair. We have a statewide campaign for adoption of children. So we've had a Virginia Adopts campaign for a number of years. You may remember a couple of years ago, we funded the Faster Families Highway to increase and improve the expediency of getting families not only approved, but get them through the process much more quickly. Because one of the big issues at that time was that it's taking too long to get the approval process done. So we standardized that, created it across the entire state. You actually fund a vendor to pay for that, and so that's something that you graciously provided to us a couple of years ago to do that, and we continue to do that today. So those are our primary ways that we do that. What I will tell you is the biggest place that we are missing families is we have families that do not take older youth. So, and one of the big conversations I always have to have with everyone is to remember is the majority of children that we have available for adoption and permanency in child welfare are youth that are older and sibling groups. So we're not talking babies, we're not talking children that are coming straight from the hospital into care. We're generally talking multiple children and children that are older. And we really struggle as a state in finding the families for those children to be able to get them. What I will remind everyone is we have one of the lowest entries of children coming into foster care because we do the work with families before children have to enter care. So it's a balancing act as we have this conversation, and you've invested many dollars over the years as we've tried to move in that front side of trying to support families and kinship providers in the community.
Well, we appreciate all the work you're doing to make that happen. Okay. Did we interrupt you? You're still going? No, you finished.
I'm done,
You finished, okay. So
unless
we
you say
need-
otherwise.
Yeah. We got questions from anyone on the committee. Delegate Hodge, do you have a question? No, sir. Okay. Delegate Carr?
No, thanks.
Okay. Well, thank you for coming on this Friday afternoon and being with us. And there's a very important work you're doing, and it's very complicated. And the previous, if Commissioner Smith was still here, I would say the same thing for him. He's got you guys have some of the hardest jobs in government, I think. Maybe because I spend more time in this area. But keep up the good work, and so we'll see you soon. Hope you won't be too mad at us when the budget's finished.
Thank you.
Thank you. All right, bye-bye. Thanks. And unless there's objection, We're adjourned.
Thank you, Mr. Chairman.
I missed it.